Doctor, welcome to South First.
Thank you.
Thank you so much for giving us a lot of information in the panel discussion, in the fireside chat. But today I want to ask you some of the basic questions which we normally at South First get on our emails, on our Twitter handles to be asked to doctors like you.
Sure.
So my first question is talking about, I know we discussed quite a lot on hair loss, but then my first question is on the emotional pain that hair loss actually causes. That is much, like almost 10 times more than any physical pain. So why is it that hair is such an important thing for a person?
Well, see, here it brings a lot to your physical characteristics and to your personalities. Now, you imagine a young guy in his college who is having bald, who's going bald. Now, his colleagues are going to make fun of him. So that's a fundamental problem, and he will be looked down upon. And because of this, he would feel less confident. When the same thing happens nowadays, same thing is happening even for school going kids, even in early adolescent. So that is very, very troubling for them, and they are very disturbed with them. And then moving forward, we get a lot of patients who want to get married. Their parents now are worried that they will not get good match because of this. This is an unfortunate social reality. In reality, I believe that your personality and confidence should have nothing to do with your appearance, but the reality is different. So the looks do matter, and people feel very confident. I have had patients who were completely underconfident, who were struggling with their jobs, struggling with their personal life, and hair transplant gives them such a huge boost that their appearance improved physically, but their overall persona improved drastically after the procedure. So hair does play an important role, whether we want to believe it or not.
Right, I totally agree with you, sir. What are some early red flags that we are missing when it comes to hair loss?
Now, you see, in general, what everyone needs to understand is falling off up to say 50 hairs in 24 hours is completely normal. Everyone loses some hairs, and because that many hairs are recycled. Okay. When you start to lose more than 50 hairs per day consistently, then the first thing which you need to do is to consult a dermatologist. And you should do this in early stages. At that time, it is possible to improve this just by some basic nutritional factors or by some medicinal treatment. With some very basic treatment, you would be able to control hair fall. The problem is people go into this vicious cycle of using the various kinds of oils and some desi nuska Ayurvedic treatments. They don't take proper treatment when it's required, and many of them get too late to reach to a dermatologist. So just consult a qualified dermatologist for your hair problems. If you are consistently facing hair loss of more than 50 hairs per day, then you should consult a qualified dermatologist.
Okay. So how do we, suppose somebody is taking bath and they're losing hair, or they're combing and losing hair, is there anything that they need to observe when they're looking at? Because normally what happens is, even like you said, even if I'm combing my hair, there is certain hair that comes out, right?
Yes.
And you tend to think that, oh, I'm losing my hair. There's so much of stress on that itself. So are there any signs like that we can actually notice?
Yes. So that's why I said that it should be more than 50 hairs in 24 hours. So just see, when you do combing and few hairs are coming out, this is okay. Also, what is going to happen is, suppose you shampoo your hair once in a week or once in 2 weeks. Now, when you're doing it less often, when you're doing it once a week, then on that day, you will see more hair fall, because this hairs which was supposed to fall off, when you do the shampoo and when you massage your head vigorously, more of them will fall off on that day. That is a cumulative hair loss for that week.
Okay.
That still is okay. But when you're consistently facing increased hair loss of more than 50 per day, and you are seeing visible thinning of the hair or visible increase in the partitioning of the area, then it is a sign that you should consult your dermatologist and start on treatment. And in early stages, it does not require too much. You will just require some basic treatments and you would be good to go.
Okay, okay. So when it comes to treatment options per se, other than the transplant is probably when the dermatologist might decide that you need a transplant. But before that, what are some newer treatment options that have come, or what is the best treatment option that you can say, or is it case wise? How does it go?
See, hair transplant for us also is a last resort. We
Exactly.
don't directly go to hair transplant. In most cases, we first try and improve it with medical treatment. So first thing is we will make a correct diagnosis. We will see what is the actual reason for hair fall, what are the factors which are contributing here, what all things which we can improve. So even in patients whom we consider doing hair transplant, we try and start them on medical treatment in regenerative therapies first. We do some basic tests to see if they are deficient in some of the common nutrients which are required for hair, and we first try and improve them, and then the areas which have gone completely bald, for them we plan for hair transplant. So this journey, always this is a ladder. Most of them we will treat with medical treatment, and some we will also add some regenerative therapies option like PRP and other therapies, and then in very few we will go for hair transplant.
Okay. So when you look at who is a candidate for a hair transplant, is there any criteria as such where you say that okay, this person can be a candidate for a
Yes.
hair?
So see, those who have a receding hairline, whose hairline have gone back and they want to restore their hairline, for them certainly hair transplant is going to be a big boost, because unfortunately medical treatments does not work very effectively in the front area and in the hairline area. So that is a problem, and in this hairline area, hair transplant is the only solution to bring back the hairline. Also, when you want to increase the density in a particular area which has gone completely bald, then hair transplant becomes the only option.
So for men, it is quite easy to kind of notice that. For women, what really are the signs to observe that there is they need hair transplant per se, and what is the difference between the kind of treatment the man and woman might go
See,
through?
women, there's usually two kinds of hair loss in females.
Yeah.
Those females, most of them, they undergo a typical what we call as female pattern hair loss. In that, their partitioning area starts to become thin, the partition starts to widen up, and they start to notice increased thinning in that entire region around the partition. So that starts to happen, and in those cases, we initially mainly improve with medical treatment and regenerative therapies. The second category is females who are having more of androgenetic alopecia. So they start to have something similar to male pattern hair loss. Their hairline starts to recede. They starts to have more hair loss from the sides. And in this area, we might need to improve the hairline. So in females, it depends upon what kind of hair loss pattern you are having, and are you able to improve it non-surgically, which we always try first. And then if in some cases when the density have significantly gone down, especially in this frontal area, and there you want to increase the density, for that hair transplant becomes the most easy option. And now with long hair FUE, we can also do it without any trimming, without any downtime, which has made hair transplant in females much more easier.
Oh, that's interesting. So what about, like why do we actually lose so much hair, first of all? And the second thing is, when you're looking at hair loss per se, suppose you're going for a treatment option. So normally what happens is everybody comes for a treatment, they'll take it for like 2-3 months, maybe all those serums and things like that, they use it. And then they stop it.
Yes.
And then this whole thing repeats. So is it like a long journey, or how does it go?
See, hair loss is a progressive phenomena. So in general, if I have to elaborate the reasons for hair fall, most important is the genetic factor. So what genetics wise, what genes have come in you, so that determines the maximum portion of hair loss. Other than that, there are nutritional factors, hormonal imbalance, and genetic factors and stress. So this all plays a role, okay, in various proportions. In male patients, mainly the genetic factors is the most predominant. I would say almost 80% is determined by genetic factors. This other plays a minor role. In females, it is different. Almost 50% of it is determined by nutritional factors, hormonal imbalance, stress, and other factors. So in that particular patient, which of these factors are more dominant, we need to see and treat them. So this is the first thing in terms of treatment. Those who primarily are affected by nutritional and hormonal factors, they can be improved significantly just by improving that. But genetic factors we cannot change as of yet, and we have to treat them accordingly.
Okay. Are there any particular tests that can actually determine that, whether
Of course. So for nutritional factors and genetic factors, it's nutritional factors and hormonal imbalance, it is quite easy to do some basic tests, which we like to do in most of our patients. For genetic factors also, now we have detailed genetic analysis available, which can exactly pinpoint what is the probability of this person going bald in future, or what are the genetic factors. Now we actually can do a genetic test, a simple swab test for a newborn, and I would be able to predict what is his likelihood of going bald in, say, 20s or 30s. We can actually predict that. Now we know that quite efficiently, and we can give them more targeted treatment, but we cannot change the genes yet, but we can give them a treatment based on their genetic issues.
this is already available in the south as well?
Yes. So now this kind of tests were available at a very rudimentary level initially. This was available in Delhi and Mumbai initially. Now we are bringing this test at a much bigger level. I believe in next 1 or 2 months it would be available everywhere, so that people would be able to do it, so that they can know what their genetics is telling them, and they can do a treatment based on that.
Okay. So first of all, very simple question a lot of people ask me is hair transplant painful, first of all, and is it permanent?
Okay, so I will start with the first question. So first of all, hair transplant is done under local anesthesia, which means that you are awake throughout the process. We numb only the area which we are targeting. Okay, so the area where the grafts are extracted and the area where the grafts are planted, this is numbed by local anesthesia. The only time patient feels pain is when we are giving the local anesthesia, when we are injecting the local anesthesia. For that also specialized techniques are used to reduce that pain and that discomfort. That discomfort is just like you give blood sample and you get a prick. It is much less than that actually. So you feel a little bit of pain only when the anesthesia is being given. Other than that, during entire surgery and even after surgery, there is absolutely no pain. So you're completely comfortable. The only time you feel pain is at the time of anesthesia. Now, in terms of safety, because this is done under local anesthesia, if it is done by a qualified hair transplant surgeon, which should be either a dermatologist or plastic surgeon who is trained in this, done in a proper operation theater, which needs to be properly sterilized, then it is a very safe surgery. So in general, till about 5 years back, major complications were never reported in hair transplant. But now, because lots of non-qualified people are doing hair transplant, there are dentists who are doing hair transplant, there are technicians with no medical background, they are doing hair transplant, and many of them are doing it in saloons. These are not proper operation theaters. And which obviously will lead to complications, which we are seeing more and more nowadays. So you need to consult a qualified dermatologist or a plastic surgeon if you want to go for a hair transplant. Don't fall into trap of so-called offers.
So are there any people who cannot get a hair transplant done? Is there any criteria like that?
Well, see, first of all, hair transplant, we do a detailed medical investigation to see is there any safety issues. So patients who are on blood thinners, okay, or who are on drugs which are cell cycle inhibitors, they will have reduced response with hair transplant. They will have difficulty in terms of surgery. So in those cases, hair transplant is avoided unless this treatment, that thing is sorted out first. There are some disorders which there are some primary inflammatory scarring alopecias in which our own immune system is destroying the hair roots. If someone is suffering from these disorders, then hair transplant also will not work, because your immune system might target even the transplanted hairs. So this diagnosis has to be made by a qualified dermatologist first, who need to identify what kind of hair loss you are having and can this be treated by hair transplant or not, because there are some diseases in which you just need to do medical treatment, or we just give few injections and the entire hairs come back.
Okay.
So there is a condition called alopecia areata in which you have patchy hair loss, and just by giving some medical pills and giving some local injections into the area, all the hairs come back. And this has happened to me. I also do OPDs in some of the low income places and do some charitable work too. And there I treated some older patients with alopecia areata. I treated them, and then on my next scheduled visit after a few months, many of the older males who were grade 6, who were completely bald, they came to me and they were asking that you did some you gave some treatment and all his hairs came back. Now we also want the same, but they are suffering from androgenetic alopecia. They will require a full-fledged hair transplant, which will cost a decent amount. So it depends upon the diagnosis, and you first need to have a correct diagnosis and then you get the correct treatment.
Is it permanent, sir?
Hair transplanted hairs are permanent.
Okay.
So suppose I am doing hair transplant in the front area of a person, that hairline which I am making and the front hairs which are transplanted, they will stay permanent, but that does not make your other existing hairs permanent. You may keep losing hairs from other areas which are not transplanted, and you may have more baldness in future, and you may require more hair transplant in future if you don't use proper medical treatment.
And that can be done.
Yes,
they can go in.
depending upon it's always a function of resource versus requirement.
Yes,
so how much is the requirement, and do we have enough resources? In male patients who are very hairy, who have good beard, Indians are fortunate to have good beard, more so for South Indians I would say. So those who have good beard and body hairs, we can transform even complete baldness also. If we have enough hairs, even grade 7 baldness, those who are completely bald, we can completely transform them if we have enough donor hairs available.
Oh, that's very interesting. So, I have some readers' questions as true and false. You can just choose. Before this, I just wanted to have one question on who your youngest patient for hair transplant and your oldest patient.
Youngest, I did hair transplant in a 10-year-old child. He had an extensive burn injury, so his entire one half of the scalp was completely burnt, and you can imagine the plight of that patient, that he was having difficulty in going to school and all. He had lots of issues, and people told them that it's not possible to get these hairs back. So then he came to us, and fortunately we run a program called Operation Hope by FUE Asia, so in which we do charitable hair transplant for such unfortunate victims of secondary cicatricial alopecia or scarring alopecia. So that patient had an extensive burn injury, and we did hair transplant for him. We actually had to do 3 different procedures for him to get his hairs back, but we were able to completely restore his entire hairline and complete hair structure, and he now is pursuing his college, and he is very happy to get he says to me that he got his new life back.
Right. Your oldest, sir?
Oldest I have done for 74 years.
Okay.
So usually in older patients there are more comorbidities. They sometimes have hypertension, diabetes. We have to deal with other comorbidities too in them. Otherwise we can do it in old patients too, and we design a hairline which matches their age, so that it looks natural, and it's done in such a way that no one else can tell that these are transplanted hairs.
Okay. So our 5, or maybe you can give us 3 daily mistakes that we do that is actually leading to a lot of hair loss, hair fall.
Okay, so first of all, don't do any parlor procedures like straightening, rebonding, keratin. Don't fall into trap of this beauty parlors. Doing any of these parlor procedures is invariably going to lead to increased hair fall. Okay, none of these procedures are permanent, and they will lead to increased hair fall in future. They damage your hair structure and they cause increased hair fall in future, which they will not tell you. So first of all, don't fall into trap. Only thing which you need to do for your hair is normal shampoo and conditioning. That's it. Secondly, don't use too narrow toothed comb. Don't be too harsh on your hairs. Do proper hair conditioning, which you can do at your home by using simple conditioners. You don't require anything fancy or special. Do proper conditioning and kind of try and manage those hairs at your home. The third thing which you can do is to kind of improve your nutrition. Have a high protein diet which is rich in nutrients, in vitamins and minerals, which you should incorporate in your diet to make your hairs better.
Okay, sir. Okay. So this quickly I'll go through. You can just tell me if it's true or false, and in 30 seconds you can tell me why it is true or false.
Yes.
So does wearing helmet cause hair loss?
No, it does not cause hair fall. It's a myth. So it does not. In terms of your nutrition, hair from outside is dead. Your living part is hair root. That is not affected by wearing helmet or anything. So not a problem.
Okay. Does frequent shampooing actually cause hair to fall more?
No, actually, if you do frequent shampooing, probably the ideal time to do shampoo is like 2 or 3 times a week. That is what we recommend. With shampooing, the only hair loss which happens is the hairs which were already in telogen, which were supposed to fall off. So it per se does not causes increased hair fall. Ideally, you should do it 2 or 3 times in a week.
Is onion juice actually scientifically useful?
Unfortunately, no. The only indication in which it might help a little bit is alopecia areata, where it may cause irritation on the scalp and may help in getting back some of the hairs. But there also, it's not a very effective choice per se, and it may be counterproductive. It may cause irritant dermatitis in that area and may cause hairs to fall. So, not a good idea to use this on your own.
There was a very popular, very viral Instagram video where they were rubbing garlic, potato, and coffee powder on a boy's head for regrowing of hair. So, does this work?
No, again. So, this kind of treatments are primarily aimed at irritating the scalp. Okay, so the idea is to you kind of irritate the scalp so that the blood supply is more and you may get some new hair growth. Unfortunately, this kind of treatments are more likely to be counterproductive, because if the garlic concentrate is in higher concentration, that may itself cause a irritant reaction and may even cause a burn like injury on the scalp if it is in much higher concentration, which may be truly counterproductive, because it may cause scarring in that area and may permanently reduce the chances for to regrow hairs. So this kind of treatments are not particularly effective and people should not be trying at their home. Consult a qualified dermatologist what treatment is required for you. Don't fall prey to this kind of reels. This kind of reels are created by people who have zero medical background. And for now, you must have heard China have recently passed a law that anyone recommending any kind of treatment has to have a medical degree for that field to recommend that.
Right.
Yeah, so and India badly needs
that's
it.
definitely needed.
Yes.
So does oiling stop hair fall? A lot of people, because it's come as an age-old tradition, a lot of people oil their hair, leave it through the night, and then wash their hair the next morning, thinking that will help in stopping hair fall and also regrowth of hair.
Okay. First of all, in one sentence, if I have to say, so oiling does not help in controlling the hair fall actually in any way. The reality is the oil molecule is much bigger and it cannot penetrate even the first layer of the skin. Hair roots, which is the living part, is almost 5 to 7 millimeters deep, and hair molecule never reaches to that depth. First of all, this is a complete misconception which many people who are advertising this. Hair molecule is too big to reach to the hair root. What oil does actually is the conditioning effect. So oil actually acts as a conditioner when you apply it on the length of the hair. So when you are applying it on the hairs, those females who have bigger hairs and they are applying it on the length of the hair, then it gives them a covering and it gives them a shininess. Okay, that actually is a good part. So it actually is acting as a conditioner and coats the hair. Okay, for that purpose, if you're using oil, it is completely fine. The problem is people starts to apply it on the scalp. Okay. The problem is our scalp automatically produces oil. We have oil producing glands on the scalp. When you apply oil from outside, this inhibits the oil producing glands to produce their own oil. First problem. Secondly, this oil is sticky. It attracts pollutants and dust and it blocks our normal ducts and pores, which is counterproductive, which leads to increased which manifest as increased dandruff or increased seborrheic dermatitis in such cases. So even if you're applying oil at night, that is fine, that is okay to do, but then you have to wash it off from the scalp in the morning before going out. Okay, so if you do that practice, it is okay to do it. Oil primarily should be used on the length of the hair as a conditioner. As a treatment for hair fall, it simply does not work.
Okay. Thank you very much, doctor. It was wonderful speaking to you. Thank you, sir.
Great. Thank you.
That is all we have. Thank you.